Welcome to All Things Home Care with Dana Arnone. I'm your host, Dana Arnone, a registered nurse with 30 years of home health care experience. Today, we're going to kick things off by going out into the community in a segment that we call Out and About with Dana. So let's take a look. As I said, I was an aide myself. I worked in home care and I worked in a nursing home for many years while I was going through nursing school. Today is a great day at Reliance. It is something that I have worked on for so long, and we are just so proud to be offering a clinical rotation through a home care agency for nursing students, because right now home care needs nursing students to know what home care is about. And we're going to go over how many hospitalizations did we have, how many incidents did we have, how many complaints did we have, how many falls did we have. You know, COVID brought out a lot of different issues, and I think it really did shine the light specifically on home health care and how essential these workers really are. So for me, it's always about bringing the youth into home care, showing them exactly what we do in home care, and it's not a scary job. It's not scary, to say that they're a home care worker, but on the positive side, they can be proud of it.
Is it reimbursable by insurance, or patients are paying? I have a lot of experience myself in home care and hospice home care. You are on the road, you're independent. It is a very challenging field, and I particularly think it's wonderful.
I used to be a nurse liaison for VNS Home Care, so I have many jobs, by the way. Labor and delivery, open heart, case management, but home care is my niche. I found my niche in home care. But speaking as a nurse liaison for VNS, we would go in and assess the patient to see if their home care, if they're able to get care at home, because not every patient is a home care patient.
We're part of the community mental health class, so we were advised that this opportunity would be available to us. This will help students when they're in the hospital to realize that they should be aware of where patients are being discharged to, that patients are not always going home to a safe environment. They might not have all the resources that they need in the home, and that they really need to be a patient advocate in the hospital also, and listen for cues that the patient does want to go home and says, oh, well, everything's taken care of. But then if you hear, oh, well, my daughter works and I live alone and I don't have a car, maybe you should start investigating and working with the discharge planner at the hospital.
My daughter's a nurse. She went through all her clinicals, and I'm like, Jessica, why don't they give a clinical in home care? Because home care is the future of healthcare. The home care worker knows the most about the patient's welfare, because they spend 7, 8, 9 hours a day. They speak their language. The clients trust the workers. My name is Rona Shapiro. I'm Executive Vice President of 1199 SEIU, in charge of the Home Care Division. I'm very thankful to Farmingdale, and I'm very thankful for Dana and her staff that she was actually able to bring to fruition an idea that we've been thinking about for years, and that is the value of having nurses do a clinical rotation in home care. People have a right to age in their homes with dignity and respect. So we're very excited because we know, seeing all these young, enthusiastic nurses that want to learn and want to care. And I think being in the home care experience can only make them better nurses and better healthcare professionals.
I know you want to be specific talking about tuition reimbursement, right? We also call tuition assistance program because the tuition could be either reimbursed to you or issue a voucher directly to the school. We are here to support our members to achieve their career goals and education goals. And I like this idea. They get to know what the home care workers' work look like, their day look like. So they have a better option to see the whole healthcare team. They have all the data. It's not just go directly to the hospital.
There's an art and science to nursing, and I would suggest you practice both. The science is that I know what COPD is, I know what to do, but the art is when you give of yourself and you go that extra mile.
I chose nursing because My sister was sick for a while. She had leukemia, and the nurses impacted my life, her life, my whole family's life in a very significant way. And I want to be able to impact other families like they did for us. Anyone could walk into a patient and say, "Hi, my name is whatever. I'm going to take your blood pressure. Are you okay?" And then walk out of the room. But another element comes when you then get to know the person, you get to know what they like and their interests and their concerns.
If you talk to older people and you say, how do you feel? I'm fine. What's wrong? Nothing. Meanwhile, they got UTI and they got this and they got that. And so it's very easy for the doctor to miss a lot of these diagnoses because unless you're actually in the house, know how many times the patient is going to the bathroom or not going to the bathroom, knowing if the patient's sleeping or not sleeping. All of those kind of daily living actions tell about the health of the person. And so when a nurse comes into the house and they say, "So how is your patient doing?" We are trying to train new nurses, and they see a home care worker in the home, to talk to them.
I think the thing that stood out the most was that the aides are a very big part in nursing, and they are right next to the nurse. They're with the person the entire day, and like my grandparents have home care, and if it wasn't for the aides, I don't know where they would be.
So we really have to engage these workers and teach them what it means to keep these people at home.
I always just have like a drive to help people. I always wanted to be in the medical field as well. I knew that I wanted patient interaction. I used to be a medical laboratory science major, but I realized there's no human interaction there. You're not really helping people get better. You're just testing specimens.
I will tell you, your skill set is far better being a home care nurse than it ever will be in a hospital, mostly because in the home, you're by yourself. It's me and that patient. It's not.
I think what's most surprising is that usually we're geared to go into med surg, we're geared to go into the hospital, but there's so many different opportunities with home care that we haven't really thought about before. We always think that we're going to lose our nursing skills if we do something other than going inside the hospital, but she was telling us how since we're the only person there, it actually sharpens our skills because we only have ourselves to rely on.
I've worked in a hospital for a couple of years, and so I've worked in all different kind of units. Home care is one of those things I always considered because it's very flexible in terms of scheduling, and I think I like to work by myself. So.
Congratulations on your journey. Good luck.
I was in and out of hospitals from a young age, so I was around nurses a lot. And I also more recently was exposed to being a patient during COVID, which definitely reinforced why I wanted to still pursue this field. And my grandmother was a nursing assistant, and she definitely inspired me, so that's a big reason.
As a nurse, when we're going into the home, if you're seeing anything that looks like it's a little off or there's some complications coming, what our role is to inform the family, inform the doctor, and educate the aide.
Well, I'm a nursing assistant at a hospital now on Long Island, and it is true the aides are the eyes and ears of the nurse. We are there, we see things sometimes when the nurse has a lot of patients. I work in an emergency room, so it gets very hectic, and we are the ones who can catch things sometimes and bring it to the nurse's attention to really get the patient the help that they need. We all work as a team, but the home health care aspect is definitely underreported. We don't know enough about it, so to do at the clinical level, it's definitely opened my eyes to maybe pursuing, as Melanie had said, later in life, to do this as maybe a part-time profession.
We're going to do some starter cares here today too. We're going to show you the paperwork. I'm hoping that this is the first of many. We're looking to engage as many colleges and nursing schools that we can in order to help promote and educate them on home health care. If there is a nursing college out there that is interested in partnering with Reliance or learning more about our clinical rotation, come down to Massapequa. We are here. I am here. And we can start that conversation. We'd love to talk to you. Hi, welcome back to All Things Home Care. It's time for Ask Dana. Today we're going to focus on questions we received about in-home services and what to look for. Patients have the right to choose their in-home care provider. To get the highest quality of care, it's important to choose the home health care provider that is best suited for you and your loved one's specific needs. Before choosing a home health care agency, interview several providers and ask about the following. Are you inspected by an outside organization? And if so, when was the last inspection? That's a great question because each agency is inspected by Department of Health, usually within 3 years, and that inspection should be posted online. I know that if there's any questions that anybody has, that you can definitely access their history of any type of audits and any type of the last Department of Health survey. Are there patients, caregivers, and healthcare professionals who recommend your home care agency? One good thing that you can probably do is go online. You can do a Google review, or you can even look at their website. I know a lot of companies will list their reviews that have been from other people that utilize the services. So that's something that maybe you can get a good little baseline on how that agency operates. How do you measure quality? That's a very good question as well. I know that surveys usually do go out where we're asking families and the people that utilize our services, how would you rate us based on a few different questions? You know, has the aide shown up on time? Does the aide wear their uniforms appropriately? You know, are they following their care plan? Having that questionnaire about the quality is a good way to measure exactly how that agency performs. What happens if there's an issue or concern? I know that most people will just give a call over and ask to speak to the administrator or the director of patient services, which is the nurse in the office, and to voice their concerns, and it usually is rectified immediately. When choosing a home care agency, find out if there's staff on call 24 hours a day, 7 days a week, including nights, weekends, and holidays. Around-the-clock availability may help you avoid going to the hospital and improve access to care in an emergency. That's actually something that every agency should have. I know that all agencies have a 24-hour on-call, and if there's somebody, usually a registered nurse, that's available to the individual in the community, if there's any questions or issues, if an aide doesn't show up to their shift, or if there's a concern about the next day who's coming, there should be a 24-hour accessibility to the agency that you're engaging. What is your average response time? Well, being that it depends upon the size of the agency and the urgency of the call, but I would think within the next 24 hours, you should definitely get a response back or a call back if it's not a 911 emergency. 911 is always the go-to if there's an emergency that cannot be handled with somebody over the phone. The home health care agencies you're considering should be able to explain in writing what your insurance or Medicare will cover. They should also mention any anticipated out-of-pocket expenses up front. You know, when people utilize Medicare services, Medicare covers most of their services at 100%, but there are some managed Medicare plans that don't pay for in-home services, or there is a copay. So before you engage the home care agency, you might want to check with your primary insurance to see what is covered at 100% or what might be a copay. Next question, how much will home health care services cost? What insurance plans do they accept? And are there any additional fees? Well, right there, that's a difficult question to ask because every agency sets their own pay rate when you're looking for private pay services. So if you're going to be shopping around, you're definitely going to want to call up and ask if they accept any type of insurance. Long-term care insurance is one of the payers for private pay home care. So maybe you'd want to ask, do they accept that long-term care policy? Well, that's all the questions that we have for today. If you have any questions, comments, or maybe a show idea that you'd like to discuss, email me at info@allthingshomecare.org. Hi, welcome back to All Things Home Care with Dana Arnone. We continue our community coverage in our Out and About series, so let's take a look.
My name is David Cuevas. I am the Bureau Director for Suffolk County Department of Social Services, Adult Protective Services. And basically I'm here today just to give you a little overview about APS. Well, APS stands for Adult Protective Services. So basically we deal with individuals that are 18 years of age and older who have either a physical and or a mental disability. There has to be some sort of risk factor as a result of that disability, and they have to have nobody willing and able to assist them. So essentially what happens is they'll contact us and we deal with issues of exploitation, abuse, neglect. A lot of what we do is try to hook people up with the appropriate programs, benefits, and services. So a lot of, like for instance, if somebody needs home care, you know, part of what we may need to do is help them apply for Medicaid. get them with a managed long-term care agency, and then from there, the Medicaid home care can be put in place. As of this moment, there is no mandated reporting in New York. As a matter of fact, New York is only one of 5 states currently in the U.S. that doesn't have mandated reporting for adult abuse. As people that are providing, whether it be health care or home care, they're out there, they're out in the community, they're observing these individuals that are potentially vulnerable, that are potentially victims of abuse or neglect or exploitation. So it's important that the people that are out there that can observe it, because a lot of the individuals we work with would otherwise be isolated, so they may not have as much contact in the community. So when the aide comes in or when the nurse comes in and they can observe something that is of concern, it's important for them to be able to convey that concern to an agency like mine so that we can go out and investigate. Adults have the right to make their own decisions. This is the concept of self-determination. This means that most adults, even vulnerable adults, who may have impairments or may be facing danger, they have the right to refuse services. Now, basically what that means is adults can live where they want to live, they can live with who they want to live, they can live how they want to live. They have the right to make that decision. People have the freedom to make their own decisions regardless of whether it's a good decision or a bad decision. And I'm sure everybody in this room knows somebody or multiple people who have made bad decisions, and you kind of sit there scratching your head. I think more than anything it's about awareness. I think that, one of the things I talked about is like why APS, issues are underreported. And one of the concerns is that, adults, they're adults, it's their business. And so it's important for the healthcare providers, the home care aides to realize that that we also have a responsibility to look out for these individuals that are potentially at risk. And that's where, where they come in is they're out there. They're in situations where they can observe these things or witness or hear these things and reach out to somebody that can help them. The idea of least restrictive alternative simply means, it's very simple. When we come out, what we have to do is we have to try to provide whatever services or benefits or even placement in some situations is going to least impact that individual's freedom. It's a self-determination. I'll use a very simple example. We get involved with situations where there's concerns about money management. Like could be, we get a referral on an 80-year-old woman. Basically, we're concerned that her LIPA is about to be shut off. Her mortgage is past due. The bank's about to foreclose on her property, et cetera. So we go out, we talk to the individual, and we see that maybe her husband maybe passed away 6 months ago. He used to do all the finances, and now that he's gone, she just really has never done it. She's lost with it. She's maybe a little confused. At that point, our goal, as far as least restrictive alternative, is say, all right, maybe we could do some informal money management with you. So a worker would go out every month, say, Mrs. Smith, LIPA's due, the mortgage is due, this is due, that's due, and she'll write out the checks, she makes sure everything's paid, boom, she's good. Sometimes it's not so easy. You go out and basically, even with us prompting her, maybe she has, severe arthritis, so physically it's hard for her to write out the checks. Maybe her dementia is a little more advanced or whatever the reason may be, that at this point we can't really rely on her writing out her own checks. So maybe at that point we say, listen, we can become your representative pay. Basically that means is we apply to Social Security. Social Security sends us her Social Security benefits, and then we manage her money that way. So in that situation, we'd be able to make sure that the mortgage is paid, that the utilities are being paid, and that she's able to remain in her home. All right? But let's say Mrs. Smith has a very small Social Security, but she has high resources, maybe a high pension, and that's how she pays her bills. Well, for us, representative pay, that wouldn't be an option that we can pursue, so we would have to consider the possibility of a guardian. So now we've gone from informal money management to like a more formal money management to the most extreme version, whereas like if we apply for a guardianship, what that means is a judge says she's no longer able to make her own decisions and then appoints a guardian who at that point would then take control of her finances, whether it be her assets or whether it be her income. So that's just kind of an example of least restrictive alternative. One of the things that they're going to learn when they're out there is that even though we all have our function, you know, whether it be as an aide or whether it be as a nurse, me as an administrator in APS, is we all have a role to play, that to you know, not just in terms of what we do, but in terms of the greater good, in terms of society. And I think that the more exposure they have to this, and the more comfortable they feel with the idea of making a report, that hopefully the more effective they will be when they're out there and they do come across a situation. It's a matter of when, not so much of if, because I think at some point or other, if your career is long enough, you're going to come across a situation. So we have an intake unit because as far as APS, like I said, we're not a mandated service, therefore there's no central registry. So every county is responsible for their own intake. So we do have an intake unit that basically works 8:30 to 4:30 Monday through Friday. We have a voicemail, so if somebody calls like on the weekends or off hours, you can leave a voicemail. And basically what happens is when somebody calls the intake unit, that intake work, we have somebody who answers the phone, they take the information, they put the call on a log, and then one of our intake workers will, as soon as they are able, call back that individual and get whatever information they can to determine whether or not it's appropriate for a referral. So you may say, well, why aren't all calls appropriate? I'll give you an example. Let's say somebody calls in and says, listen, this person has OPWDD services, they're developmentally disabled, they have a case manager, they go to program, and they have all these things. And maybe the issue then is, you know, they feel like, oh, mom is leaving them alone too much or something. In that situation, we would make a referral to them to say, okay, you need to contact OPWDD, because they're the ones that would be the ones that would have oversight over that individual. So in Suffolk County, our number is 631-854-3232. Now, those lines are only manned from 8:30 to 4:30, but you can call anytime because we do have voicemail. And so if you call in the evening or on a weekend or a holiday, we will get back to you at the next available time.
Well, that's all the time we have for this episode of All Things Home Care with Dana Arnone. If you want to know more about the topics we covered today, or someone you know needs assistance, you can find numbers, links, and watch all of our episodes on our website, allthingshomecare.org. Follow us on Facebook and Instagram. And please always remember, there is no one more essential than those who come to care for us in our home. See you next time.
All Things Home Care elevates and supports home health caregivers by providing transportation and promoting education to better care for homebound seniors and the disabled. To find out more or to make a donation, visit us at allthingshomecare.org.